that we have forgotten the patient in front of us. Technology can be used for good or for evil. And when I saw what he was doing, I had this wow. I was Googling something from a frame on my head. I said, I gotta use this in medicine.
You were the first, I think you were one of the first people I saw anywhere using Google Glass.
Like I said, I'm a little bit of a nerd, I guess, or geek in regards to technology.
How do you see that affecting your work?
That's such a problem. I think that's probably the best advice I've ever heard. And that is a problem. That's a disgrace. We should be ashamed that.
Health systems need pioneers like Dr. Rafael Grossmann, professionals who are brave enough to try out new technology in a healthcare setting, sometimes years before the infrastructure is really ready for it, and even to be the first to discover the value of those technologies for better health. We recorded this conversation last year, and I loved catching a glimpse of the opportunities that new technology is going to bring us in 2026 and beyond. And as always, I was inspired by our chat about the role that social media has played in spreading new ideas about tech in healthcare. The best part that I learned, how technology will connect us together better for more humane healthcare. So let's go. I'm so glad to be joined here by Rafael Grossmann. He's an internationally recognized general and trauma surgeon and definitely a significantly disruptive digital health innovator. Dr. Grossmann, thank you so much for joining us today.
My pleasure, Daniel. Thank you for having me.
Brilliant. Can you tell us a little bit about your current location? What's the view from your chair right now?
Well, I'm currently at home right now, but because I'm off. I was on call yesterday. I'm on call tonight, but I'm based in New England and near Boston in New Hampshire and Maine area. That's sort of my grounds. Been here for many, many years. I practice in surgery and like you said, trying to disrupt healthcare by the smart use of technology.
Fantastic. Well, tell us a bit more about that, what you do and how long you've been doing it and what really drew you into the field that you're in.
Well, I'm a physician, right? I'm a surgeon. I'm from Venezuela originally. I did my medical school, and I grew up in Venezuela. And after that, I did a rural practice for a year. We have to pay our social debt in Venezuela when you go to med school for 7 years. It's free, so you have to pay that to your country, which makes sense. And after that, I worked for 1 extra year. I tried to learn English and get to know the system in the U.S. and saving some money working as a general physician in the emergency room, because I knew I wanted to do my surgery residency in the States, in the United States. So I then went to Chicago for a year, did research, and then I ended up in Ann Arbor, Michigan in my general surgery residency for 7 years. And after that, came back home to Venezuela for a few years, and then the situation was not ideal. So we came back to the U.S., to New England, to Maine, and I helped start the trauma and the acute care surgery and robotic surgery program in Maine. And I was there for almost 17 and a half years. Wow. And when I came to Maine, which is a very rural state in the U.S., in northeastern U.S., there was a problem with the connection and with communications in a way, because the territory is so vast that telemedicine, we're talking in the year 2003, 2004, not telemedicine, telehealth now is pretty common, right? Everyone talks about it. Back then, it was nothing that people really engaged with. And we started developing a program. That's how we got into technology in a way, to improve how we connect and communicate by telemedicine. And we created a program, connected a whole bunch of hospitals in the area, distantly to us, and people even came to see how we were doing in rural health by connecting with telemedicine. And unfortunately, that program kind of died off because the reimbursement wasn't good. Eventually, telemedicine, obviously, it took only like 1 day, right? It took the pandemic to, in 1 day, everyone think about it. And within a week, everyone was doing telemedicine during the first few days of the pandemic, right? The COVID pandemic in 2020. But I mentioned this because I always been a little bit of a geek, loving of technology. And in 2010, 2011, when the iPhone 4 came out with FaceTime, I thought, wow, we have to do telemedicine and to connect to the hospital 100 miles away. I have to go sit on the big screen and log in and do the thing, and it doesn't work. And I call IT,
Mm.
and maybe it works, and the password. So now we have this, this app on a phone that can basically, tap and you get someone on video immediately. So we did a pilot program using the smartphones, the iPhones, and the iPod Touch devices that could
Uh-huh.
connect with Wi-Fi on FaceTime, and created an app that was HIPAA compliant. HIPAA means protecting the private health
Mhm.
information, and we could do the same thing, telemedicine, but in your pocket. And that program got me to do my first TED talk. I've done 6 TED talks, and this is the first
Amazing.
one was on connecting the greater rural Maine directly from the ED from your pocket by using a simple smartphone, or not even a phone, but a tablet like an iPod
Yeah.
Touch. So that got me into there, and then the rest is sort of history.
Fantastic. I mean, I've always seen you, and I've been watching you for a long time and seeing, you really are a pioneer when it comes to using technology. And as you said, you were doing telemedicine, 15 years before it became cool to do telemedicine because everybody needed it. You were there already. And as you say that, maybe that program faced some challenges because maybe the infrastructure and the funding wasn't there for it.
Yeah.
And maybe the vision wasn't there more widely, but it seems like you're always ahead of the curve in terms of how new tech can be used for better health and healthcare.
Yeah, well, I try to be. Like I said, I'm a little bit of a nerd, I guess, or geek in regards to technology. I like to use technology to sort of help me or help us, be more efficient. And in regards to healthcare, I think that technology offers the possibility to really help us communicate and connect better, learn better, teach better. I always say, technology used in a smart way to bring healthcare to the 21st century. We
Mm.
do healthcare in a reactive fashion. We do sick care more than healthcare.
Oh
That's
yeah.
a term that is, being used a lot. Sick care, and it is because we really don't use the tools that we have. We're still facts based in the year 2025.
Mm.
Believe it or not.
Amazing. And I want to ask you about, you mentioned education. And I remember you were the first, I think you were one of the first people I saw anywhere using Google Glass. But there are many today who may not even remember Google Glass because now we're seeing a new generation of digital eyewear coming out. But Google Glass, do you want to just talk about that?
Yeah, when after I did my first TED talk, I started getting more and more into the platforms of exponential technology, and
Mm.
had the honor to meet Daniel Kraft, a good friend of mine, who had this program in Silicon Valley to sort of expose people, usually healthcare related people, in the use of exponential technologies in healthcare.
Amazing.
It was like a week long program called Future Med back then. So I ended up by going to that program, and it was like an educational program where we sat in this room, with one after another. We got this people that looked like from science fiction, showing us cameras that took pictures sideways, and different devices, and then one of them was Google Glass, and one of them
Mm.
was the inventor of Google Glass, Babak Parvis. This is in 2012 and
Mm.
2013. And when I saw what he was doing, I had this wow, similar to when the iPhone 4 came out, with an app that could let you
Mm.
do video. I said, wow, if this app can let me stream video and take pictures and also connect to the internet, and I could ask a question and get an answer immediately, similar to what we're seeing with large language models right now. You ask a
Mm.
question, but that was just connected to the internet. I was Googling something from a set of, of a frame on my head. I
Mm.
said, I gotta use this in medicine. So I cornered him, and within a few months, I had one. And within a few days, I thought of, well, I gotta use this to improve how my students learn. In
Mm.
surgery, like in medicine in general, but especially in surgery, it's a you are a sort of a witness to what's happening. You're learning by
Mm.
seeing. Hence the name of surgical theater, especially in the
Yes,
UK.
of course.
Surgical theater. Here is operating room. There's surgical theater. So, but students are behind you, trying to see what you're doing, or they're helping in the case, trying to learn, and they're asking them questions. They're asking you questions. So I thought, well, how about if I have the camera streaming, and instead of being behind me trying to see, they can just be sitting sipping coffee in a room. So two of them were in a next by room, and I was doing a procedure, and I was streaming from my perspective. So it wasn't really like I was streaming with a GoPro or with a camera on the wall. I was streaming from my perspective.
What
So
you
they were
see.
seeing exactly what I was seeing in real time, and they were asking questions, answering questions. So I thought that technology allowed me to really bring their learning to a different level. And that, I posted about that. And my good friend John Nosta, he posted something and that went viral. And then next day I'm getting calls from, from China, from Argentina, from Italy, from, hey, what did you do? How'd you do that? And I just didn't really humbly do anything more than take the device, think about how to use it, and a device that was created for taking pictures of your cat or your daughter dancing or whatnot, you could also use in a smart way to improve how someone communicates and connects, how someone learns and teaches. And that's sort of the beginning of a long, long career. And that was, I think, the first step really in the use of a head-mounted sort of smart device in the operating room and then in healthcare. And now we have many iterations of that, and we have advanced from Google Glass, a frame with a camera and a glass, really a screen, connected to the internet, to devices now like the Meta display that came out today, basically available in the Meta stores, where you have a pair of glasses, not as thin as this ones, but and I don't have my Meta with me here, but basically a set of Ray-Ban glasses that have a screen in there and are connected to the internet, and you can take pictures and stream. So we have advanced incredibly. Devices like Apple Vision Pro, which is a supercomputer in your head, which is connected to. So I mean, medicine is advancing to levels not seen before, but it is advancing because some people, me included, I want to say humbly, is bringing those technologies out there that were created for play or for gaming or entertainment to maybe the operating room and beyond in healthcare.
And that's the thing. And I think that's one of the things, one of the gifts that you bring to this is, when Google Glass came out and these other kind of tools, while the rest of us, as you said, taking pictures of our cats, you're thinking like, hold on, this has a healthcare application. And so I think it's your ability to kind of make that connection and be visionary about it and think, right, it's a device which is available now, as you did with telemedicine right at the start. And you make the application and you think, right, we could use this in a positive way to enhance what we're doing, enhance learning, enhance communication. So with that in mind, what excites you most about kind of new advances in, let's say, in technology that have a potential application in surgery today?
Well, I'm going to say surgery and healthcare, right, in general.
Okay, yeah.
What excites me the most, technology is advancing very, very rapidly from the hardware and from the software point of view. I think obviously we have to talk about artificial intelligence, right, which has been around for decades and decades, but now even a generative AI like large language models like Claude and Perplexity or ChatGPT style applications are the talk of the day, right? So that excites me because we're becoming very rapidly going to a place where we don't have a tool like we had before with internet. Maybe we have an assistant that can enhance how we do things. So that excites me. That, but also from the perspective of the form factor of how we connect to those technologies. Everyone thinks laptop, tablets, this is being replaced by this. And that's exciting because I think that the phone is good. I mean, I always think, 20 years from now, we're just going to laugh. Our kids or grandkids are going to laugh at how we texted messages, by doing the. So letter by letter, this is crazy.
Yeah.
Now we think of the telegraph, right? I think that in 20 years, people is going to think that this texting was a telegraph, and how did they do that? That's crazy. So I think that the form factor of the bridge between the human and the technologies is evolving quickly to something wearable, something like a glass, not like a fancy, big, bulky Oculus device that transformed into the Meta and Oculus 3 or the AVP, the Apple Vision Pro, or the new Samsung, the one that is, but it's going to be a set of glasses that is the same glasses that you use to read, but they are also projecting a mixed reality, augmented reality, and they're also connected, and they're also there like a guardian angel, telling you what you need to know or what you need to do, or maybe taking pictures of your food and telling you to eat or not eat that, or hey, what's Daniel doing today? Can you send a message? Then boom, you get a message, you get Daniel in the screen, and you can talk to him. So I think that is very exciting, because in healthcare, that is what's needed. I think that we need to optimize, how we get the human, the data, the digital data, and the digital knowledge out there, the medical
Yeah.
knowledge and data and research and whatnot to the human in front of us too, right? The patient in front of us. Because we have been for the last 20 to 30 years focused on digital health. And digital health means that, yes, we're using technologic means to connect with patients now with telemedicine, but the electronic medical records are electronic. Obviously, it's all the incredible amounts of data that are really important for research and whatnot. But all that incredible progress has meant and has resulted that we have forgotten the patient in front of us.
Right.
We go to the physician and you're like this, right? Hey, how you doing? Well, what hurts right now? Hey, so no one even talks to you. So, and instead of being with the patient 100% of the time, you are with the patient, 5% of the time, and the rest are with the computer. And now we're flipping the coin, where now I think that the technology is going to allow us to have a more humane, a more human-centered and empathetic healthcare, right? And I always talk about the paradox of technology making healthcare more humane. And it is, because now we're going to have more time, or at least if not more time, we're going to have better quality time to talk to the human in front of us, because now I'm going to have to be typing. Everything is going to be, imagine ambient intelligence. That excites me a lot. You have different monitors that are recording and are basically analyzing every piece of audio or visual data and connect it and able to discriminate what type of conversation you're having with the patient and populate the medical record. And at the end, so you have to focus on doing that or remembering that or having a scribe next to you, but it's just the artificial intelligent assistant is really doing that and enhancing how you function as a human. So I think that's
and I love how you put that, because there are people who would say they may be afraid that advances in technology are going to dehumanize human interaction, but let's say medicine, for example. And what you're saying is no, it's going to do the opposite.
100% I believe so. It has done the opposite. I mean, it has done the what you said, dehumanizing medicine terribly. Dehumanizing medicine, and not just physicians. I'm talking about nurses carrying computers on wheels, from patient room to room, documenting, rather than talking to a patient. Right? The same thing happens at every level of healthcare, and that is a problem. That's a disgrace. We should be ashamed that healthcare today in the 2025 is in the state it is in most countries. And it doesn't matter if you are a country with a great, economic development, or your country with the least. It's pretty much, the same everywhere, I think.
That what you mean, that we've got to the stage where technology at the moment still gets in the way of that human interaction?
100%, yeah, because it's not used smartly. That's why we have the tools, but we don't use them correctly, I think.
And as I said, often when I see you in your work, it looks so futuristic. In fact, if I was to ask ChatGPT to give me if I did recently, give me an image of the future, a futuristic world, what it by default puts in is people wearing VR headsets, and it thinks that's what the future looks like. But I think that, you kind of live in this part of the future. Where do you see the challenge between, how do you bring that into reality now? Where are the kind of challenges or opportunities to connect up your vision of the future and what's possible with what's really ingrained in systems and ways of working now?
Well, I think that a lot of people is working in solutions, right, that make a smart use of the technology that we have currently and the technology that we'll imminently have very soon to improve care. And I said not just surgery, because you can optimize processes in surgery by using mixed reality. There are companies out there, EX is a company that in the operating room uses basically the Apple Vision Pro or mixed reality headset to basically optimize the flow of things in the OR. There's a lot of waste in the operating room. It's a very complex environment. It's unpredictable. Even in the most elective of cases, it's unpredictable things happen. There's a lot of checklists that need to be done. There's multiple little pieces of data. So I think that by using technology to organize things, results can be improved, outcomes can improve. Experience from the provider point of view it could be improved. The experience of the patient can be improved. So, but in the hospital in general, in healthcare in general, imagine doing rounds when you go visit patient after patient. People is carrying a tablet or wheeling a computer from patient to patient room because they have to document and see, what was the temperature last night, or what, rather than having that so magically, right, appear in front of them when they see a patient through a set of mixed reality glasses, for example. Imagine that, where the doctor has a set of glasses, the same glasses that you're wearing, but those glasses are projecting you my vital signs and who I am, and that I'm severely allergic to penicillin or something, and that I had an appendectomy yesterday. And immediately what you're going to do, because you have the expertise, and hey, I wonder what antibiotic should I use, and your glasses are projecting there, and you can tell, but you're still connected to me through your glasses, right?
So it allows that. And so now it allows the physician to look at the patient whilst having all access to all information.
Yeah. And then you don't have to disconnect with me and go to look in the computer or turn your back towards me because you already have all the info that you need. But you're also seeing how I react, and I'll see that I look happy, that I look comfortable, that I'm not in pain. So everything can be optimized, and have a better connection, I think, with the two humans that need to be connected in healthcare, especially. We are disconnected, and that's a problem.
What needs to happen to get us to that kind of stage where that kind of physician-patient interaction can happen, on a regular daily basis?
Well, I think that things are happening. This is happening. You communicate, you educate people, you change the way of thinking in the general public at every level of interaction in healthcare. From the relatives and the patients to the medical professionals, and we say physicians, but physicians, nurses, techs, everyone in the scale of the chain of healthcare, and regulators and administrators, and everyone needs to be educated that these things are common, and they can come in 15, 20 years, or they can come in 3 to 5 years.
Yeah.
And I'm a believer of the 3 to 5 year mark rather than 20
I love
years.
it. Yeah, that makes sense. Not to wait for the next major global health crisis to drive a change like that, but actually just to actually get it happening.
Absolutely.
Hi, thanks so much for listening to the podcast. The conversations that I've been having with healthcare professionals on this podcast, they really confirm to me that scientific impact on social media is not shaped by how many followers you have, but for healthcare professionals, it's about who trusts you online. So I wrote this book, Peer Impact, after studying billions of social media conversations taking place between healthcare professionals and really discovering how healthcare professional digital opinion leaders have reshaped medical learning. You can actually get a free field guide to accompany the book by going to creation.co/peer impact. It's free, you can download it, and if you love it, then grab yourself a copy of the book too. So creation.co/peer impact. Thanks so much for your support.
I see you really active on social media, sharing, and as you said, communication is obviously such a key part for people to be able to see that these things are happening. Perhaps that helps to, increase their faith in these things coming as well, and to kind of set their vision for what the future can look like for them as well, if there are other healthcare practitioners or patients and so on. How important for you has social media been in your work so far?
Well, very important, right? I started using, I think the first time I started using Twitter was just a few months, maybe a year before that visit to Silicon Valley, where I met the guy with Google, the inventor of Google Glass. It's funny that I'd been in sort of interactions in Twitter, back then Twitter, with a good friend of mine now, and for many years now, Bertalan Meshko, right? And
also a futurist.
Yeah, he and I had been talking for months and months on Twitter. Not talking, but texting, Text. And when I first met him, at the NASA Ames campus in Silicon Valley. I knew him. I'd never seen him in my life.
Yeah, of course.
And he and I were like, hey, how you doing? Like we had coffee yesterday. That's
Yeah.
pretty amazing. That's pretty amazing per se. But then, I basically, I'm not a big user of social media in general, like most people would think. And I don't use Instagram or Facebook or TikTok or anything like that. I'm big user of X, formerly Twitter, and then in sort of in a professional way, where I would every I would say every day I'm looking. The information is somewhat curated, right, to the user. So, and it has to do with this general topics that I basically see that information, engage quickly with people, with the topic, with the theme of whatever's happening, get connected with new people that is in those ecosystems, and that goes from a general message to a private message, maybe hey, conference we're organizing, or I'm working on this project, can you help us? Or I ask for help, or they ask for help, and so the mix of expertise and sort of interaction, it's really phenomenal. And I would say that it would be or would have been absolutely impossible to maybe go where I have gone over the years without the advent of social media. Because even if I had done that surgery, for example, Google Glass, and I had put that on a magazine or something 6 months later in a journal, I mean, not a magazine, a journal, or a printed. But then my friend, I did a little post on that. And then my friend called me, John Nosta, and he put it on Forbes. And Forbes, within hours, it was viral. And then within hours, I was getting calls from the other side of the world. Say, hey, what's going on? And then after that, I started going, basically doing what I do today, which is every couple of months, I'd say I go somewhere in the world to talk about the smart use of technology, digital health, improving healthcare, and talking about mostly extended reality and AI, from universities to schools to big conferences, right? The biggest conference. And that is only possible because of either LinkedIn or X in my case, and email. So I think that it is really, really important that we sort of we see the power and the dangers of social media, because misinformation, right? And the bad use, sort of like you can take pictures of your cat or other things, or you can save a life using a smart headset. So I think it depends on the use. We give it, right. We humans are the drivers of what's
right. Yeah, like you say, the tech is available, but it can be used for good or evil. How do you see, I mean, what does that look like for you in terms of, I guess that, do you think there's been an eroding of trust, or, some dangers in communication? You talked about misinformation. How do you see that affecting your work or the kind of general healthcare space on social media?
I don't even know how to, that's such a problem. That's such a problem because, well, I think that it goes to what you just mentioned, that technology can be used for good or for evil, right? You can transmit a verifiable, trustable, and real facts, information to the public, and save populations, and you can do the opposite and destroy populations, right? I think that it's very important that obviously the leaders out there, make good use of their power to really give useful and factual information rather than the opposite. I think that it's a big problem because you see it at every level, right? From the malicious level, right, to the I would say the interest level, where you want to promote something, or promote a business, or promote your personal gain, or promote your teams, right? And no matter what the effect of what you do is. So it's a big problem, and I think that we that's I would say one of the biggest problems that we have today, where you don't know what to trust. And if we start thinking AI, right, it's also an assistant, a partner that is potentially very dangerous. And like you say, you could save a life or you could destroy a life. Well, the same thing with AI. I mean, obviously, I think that we are in a point where AI is to levels that are almost unheard of on thought of science fiction level that and we're barely beginning. So very soon we're going to be, I think, close to artificial general intelligence, they call it, which is suprahuman intelligence. And it's not intelligence; it's really a more something that we have never seen, and that we need to be very careful how to drive that. And we can certainly drive it to the benefit of humanity in ways that we never thought possible. But the opposite is also true.
Yeah, absolutely. Do you think that, can you think of any kind of, recent examples where you've seen the power of digital communication done really well, where a great outcome has been achieved?
Certainly. I think in the very early days of COVID, we had a tremendous impact, by using social media and digital health in populations, large scale, and the way information flew, across the world, but especially in communities and countries, right? We made a big difference, right? But the opposite was also true, in some other places, or in some places, even here in the United States, the opposite was also true, where in some places, information, spread very quickly, information that was actually not good, but bad. So the opposite effect happened. So, but certainly I would say that's a good example of how, the power of digital health, the power of technology and social media to really improve things or not.
Where do you think that the sort of greatest opportunities for healthcare professionals like yourself using social media over the next 2 to 3 years? I'm going to ask you because you have a bit of a future vision of what's coming, and you take what's available now and you bring it into reality, right? You put it to good use. So, where do you see the greatest opportunities for healthcare professionals on social media over the next few years, really?
Well, I think education. I think that education is certainly, education. Everything you do there has to be to really reach out to as many people, as many populations as possible, with factual facts about how to live a better life and how to prevent disease rather than treat it. And I think that there's a lot of there's a lack of communication out there. I mean, we don't have time to be in front of a patient more than a few minutes, right? And that's even worse in some of the countries, and it's pretty bad in the U.S. But I think that if we do have the tools to continue to enlarge. To spread the time that we can be in front of someone, and social media can allow you to do that. I think that we have a great opportunity to use the technology, right? The tools we have to educate and change the way of thinking and do good instead of not. I think that, like I said before, we've had clear examples of both of those situations in the recent, COVID pandemic, and I think that it's even easier now to be more thorough and to reach out to more people and to have the ability to spread the good news about the potential change.
That's amazing to see that that's still, maybe the best, most effective way to combat the misinformation and the other kind of negative disruptions that are going on by simply actually continuing to use it for good in a positive way.
Yeah, absolutely.
Is there anyone that you think is using social media particularly well right now for better health, whether that's health professionals, scientists, even patients? Who do you think is doing it well?
Well, I think that a lot of people are doing great things, and they are in social media, right? They are, for example, we mentioned my good friend Bertolan Meshko, and he has a great team of communicators, and that's what he does. That's what he does. And if you go to LinkedIn or you go to X, he's on those channels, and I'm pretty sure he's on all the other channels as well. So I think that he's a good example of how you can grow as a professional with a good mission, to reach a lot of people. people. I think that's I would say an example that stands out. I think that there are many. If you think about Eric Topol, for example, Eric
Yeah.
Topol,
Yeah.
again, he spreads good information, not misinformation, but good information about a number of topics related to healthcare and science. You sort of create that profile where if you read something about him, it's the truth, and he gives you
Yeah, you can
the
trust
links
it.
and the validation for that message that he is giving you that particular day. He has the links to the papers and whatnot, and the opposite as well. He gives you information, he gives you the links to okay, that is not true what you're hearing in there, because this is
Yeah.
the real science. So I would say that Eric Topol is probably my main topic, my main top candidate for that. But there are other
Love it.
many users, obviously.
You mentioned how, I loved when you talked about how, social media has actually enabled you to do so much more, connecting in real life, and has, impacted your career in terms of you being able to go and travel and speak and share knowledge and so on along the way, because of perhaps things that you've posted on social media initially. What advice would you give to, other physicians or healthcare professionals or scientists who want to grow their knowledge and the impact that they're making online?
Well, I think that you need to be very responsible, and in the early days, and still, people tell you don't say things online that you wouldn't say in real life, right?
Yeah.
I think that's probably the best advice I've ever heard. You wanna behave the same way online that you do on life, and I think that it's interesting not to mix, your sort of your professional advice page or has or a handle or name with your personal one, because social media could be a good way to personally make connections and share personal stuff or whatnot. But I think that it's important not to mix both, because it's different audiences, right? I think that when someone looks up, I think that when people probably look me up, in X or LinkedIn, they're looking for professional, information, or for what I do, or what maybe they want my help, or they want to help me, but it's not different. So I think that probably that's probably one of the most common mistakes that I see when you go to X and you see an account, and so the account is talking about some scientific or science related or tech related stuff. Then you suddenly find someone sharing pictures of, I don't know, their trip to somewhere, or I don't know. I think it loses not credibility, but it doesn't seem as professional, I think.
So keep it focused. Keep it focused on the audience that you're
Yeah,
looking to engage.
I'm also, I'm a full time surgeon, right? I'm a full time clinician, and that's for me, that's my leverage. That I am very geeky, and I do all this technology and exponential tech stuff and digital health. But I'm most importantly, 100%. I was on call yesterday. I'm on call tonight, so I know that gets me the feeling. So I don't want to mix also my obviously patients, situations or experiences, my personal stuff, not personal but professional stuff, even, right?
Yeah.
Taking pictures. Oh, this is a very interesting picture of a patient, and blah. You'd send the picture, even if you had permission. I think that sometimes, it's always a violation of the patient's privacy. I think even if they tell you differently, I think that's something, depends on where you live, very highly regulated also. But I think that even morally speaking, it's probably not the right thing to do, I think, personally. So it's just my opinion. Yeah. Hmm. I that's a great question, and I think that I've been very honored and blessed I've been. It seems like in the right place at the right time every time in this path of mine as a digital health innovator, I guess. I probably cultivate deeper relationships with people along the way. It's always something I wish we had in that one conference 5 years ago, I wish I had, really followed that this one path, or I had connected and learned more about that. Sometimes it's so overwhelming that you really have to, physically, you can't really reach everywhere. So you have to focus, and maybe, at some point you so missed an opportunity, or not, I don't mean a business opportunity, because I'm not a business person. Now, to me, it's about really improving the patient's outcome at the end. But the possibility of, wow, I could have been part of that project, or I could have made that project better, maybe, or I could have learned a lot from that project because I just didn't connect. So I can't really pinpoint, because I really, again, I think I've been blessed and honored to be many places, very frequently, with in the right spot. I can sing, when I met Daniel Kraft, a good friend, when I met John Nosta, when I met Bercy, when I met Shafi Ahmed, a good friend of mine, that we were, like very, very close. And it's because of how we connected in social media and beyond. I've been very blessed in that sense. So, yeah, it's been a great, great journey. Well, I have my website, which is informational. It's a rafaelgrossman.com or rafaelgrossman.health. But I'm in LinkedIn, and I am in X, in Twitter. It's you can find my handle in, if you go to my LinkedIn or my days of Twitter, when Twitter was starting, and I didn't know it was safe or not. I figure, oh, let me do this in a different, but it's only four letters, so I thought it was pretty clever not to have a very long name to save space. Yeah, and like I said, I have a bunch of TED Talks, for example, that many of my talks are online as well, so you can learn more of what I do. But really, it's always looking forward to connect with people who's interested, and who is interested in how we can use technology in a smart way to really improve how we communicate, connect, teach, and learn. And so, how do we enhance healthcare to really become more what it should be, which is more humane? We need to rescue healthcare, I think. Yep. Daniel, my pleasure. Thank you.